program issue. Dr. Unger may be able to address that. I haven't heard on that yet. We've been reorganized since then, so that's where the energy has gone.
Do you want to?
The question was the thoughts and plans for an international workshop.
The reorganization did disrupt those plans, and we will not be able to get that in this fiscal year. But we are making, renewing those plans. So it won't be this fiscal year, but next fiscal year. And we think that'll be more timely once we have the data from the Georgia surveillance and have the metrics that we need in order to compare all the various permutations that could be involved in case definition. So we're beginning work on that.
So we might anticipate a 2011.
Fiscal year.
Fiscal year 2011.
Yes,
October to October. Yeah, somewhere in there.
Right. So if we start making plans now, we should be able to get it done that year.
Thank you. Oh, sorry, Nancy. And then Susan.
Sort of going back to the overall topic, but some of it involves the CDC. If you look at all of these, nicely done, Wanda, for your staff to put all this together. In my mind's eye, they break down to, if we could just do it financially, things that cost money, things that redirect money, and things that don't cost anything at all. If we could sort of swing through these things with that kind of thought in mind, there were some things that cost nothing at all, like the letter from the secretary. There was a number of more validating types of strategies here and educational strategies that weren't costly. There are things that were redirecting money, like asking the CDC to develop an extramural component to their program and that sort of thing. And then there are things that cost brand new money, like the 5 centers of excellence. So if I might suggest that the problem is that our new committee members haven't, we've all been bathed in this. We go over these things every single time we meet, and it's been an exercise in frustration. But the new committee members really haven't had the opportunity to realize why there are seemingly duplicate statements. The very first page, for instance, 4 times. And I would say, as the person who's possibly had the most history, having been on this panel on 2 and 3, if you count the first iteration, 3 times. The Centers of Excellence have been oppressed from the very beginning because of the lack of access to health care and the meaning of a center to a research program. So they were rather important. But if you zip all the way back to these educational efforts, where there were the letter to the secretary. Can we go back to that one? We have a new secretary. Is a chance we're going to get a letter?
Which page? Can you give us a page or a number reference?
Let's see where that one. Let's way in the back.
Surgeon General letter is 2B507.
That's great. Perfect.
Is
the letter was written, and that was a couple of Surgeon Generals ago. So I'm wondering if we might pull up that draft and ask the new staff, the new folks. Is there a chance that we're going to be able to go down that line?
If the committee would like to revisit, would you prefer Surgeon General, who has no line authority, has a bully pulpit and educational responsibility, or the Assistant Secretary for Health, who also has no line authority, but is actually the Surgeon General's supervisor and was here with us this morning?
That would sound like a good change to the strategy.
He's more commonly the person in touch with state and local health officials. Yeah. The Surgeon General does, but their roles are different. Mm-hmm. Missions are different.
Is it possible to get someone from the Surgeon General's office to be actually a liaison or ex officio officer to this particular committee?
I suppose, again, we could ask, but what's the purported value and, recognizing the broad public health educational mission and steward of the Public Health Service Commission Corps, and a focus on healthcare for the underserved, even as healthcare is changing. If you can define and articulate a role, we can, and in particular, if you want to make a recommendation that they be added ex officio, we can, yeah.
I think when we were doing that letter before, didn't
You're not just talking to me, remember, you're
right,
talking
I'm
to
talking
the
to the group.
committee.
I'm sorry,
so.
and you may all remember better than I, but didn't someone from the Surgeon General's office work with the group, or at least with the chair of
someone
the group,
did at that
to
point, I'm
develop the
sure.
letter and so on? And then I thought the end result was, and you'd have to look through the minutes, but I thought the end result was that he didn't feel there was enough information yet, or something like that.
I think we should revisit that, and if you want to toss that to a subcommittee to revise the letter and review it, I would very much like to bring that back up on the high burner.
And decide whether we go Surgeon General route or whether we go Secretary
Right,
of
which
Health
of the
route.
subcommittees would that be? That would probably be, yeah. So,
My only concern, Nancy, is that, I mean,
but it's already written, so.
It's written. I think we should pursue it. I'm not saying we shouldn't. And maybe we should farm it out to one of the subcommittees. My concern about all these recommendations is that I don't see a strategic plan. I mean, I don't see kind of something that's targeted, that's focused, that has several objectives that we can all get behind and really focus on. I see so many different pieces here that I don't see the strategic piece of it where we're actually has a chance to affect things in a more focused way. And that's my concern as I'm looking through all these recommendations. And I know that Wanda Jones a number of times has said to us we would be more successful if we could somehow target ourselves in terms of what we're trying to accomplish. So anyway.
Jason.
Just to respond to that, I think that the problem is that when we've gone broad and we've looked at centers of excellence which have really encompassing all the issues we wanted, the ask is too large. And so maybe we're now going back to taking smaller bites with targeted issues to find things that we can, along what Nancy says, if it's not requiring money, we may have a better, if it's not requiring the same level of resources, we might be better served accomplishing what we can while we can.
I would think that targeted issues don't have to be small. Targeted issues can be very large, and they could be accomplishable, and they could set the agenda and set the bar high. So I'm not sure it has to be at a kind of a more minuscule or more targeted. To me, doesn't mean small. So I just want to define my terms.
Sorry, Susan.
Yeah, what I would want to know is like what exactly is entailed in starting a center of excellence, and how, literally the nitty-gritty of how one goes about doing that, and what agencies does one have to go through for that kind of thing. Because, I mean, for instance, in New York and the whole East Coast area where I'm from, there's nobody I can refer people to in terms of specialty care or primary care doctors, and I certainly think there's a need. And I know there's some in other parts of the country, but I mean,
we were urging that people bought into the project. I think there's some work to do to decide what a centre of excellence looks like. There are private entities that have determined what they think it should look like, but it is a big question because it's a lot of money, obviously.